located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health for every day. Our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, for each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Lollipop, get that recorder cranked up and ready to go. All of you who record these shows will want to do the same today. How about this for hypothetical questions? Do you have a GI problem that's so severe that it impacts on your life in a way that it doesn't affect others? Does your daily activity revolve around how close you may be to a bathroom at any given moment? How about this? It's so necessary that you be near a bathroom that you can't even leave the house. Are the medications that you may be taking for your GI disorders, and in some cases, reach thousands of dollars per month? Now, if the answer to these questions is yes, you're going to want to pay attention today to our special guest, a naturopathic physician from the state of Washington. Her name is Kathleen Janel. She was here 2 weeks ago for what we call part 1 of LDA, that's low-dose antigen, and the treatment of GI disorders, and how it may very well be that you can correct, and I do mean correct, reverse. The C word can be used here. These serious gastrointestinal issues can be corrected with LDA, and it just so happens we're launching the LDA treatment protocol in our office this month. So everything is working out rather timely. You're going to want to listen today, and then you're going to want to make an appointment to come on in and have a discussion with me to find out how we may plan to get you involved with LDA treatments. The number, of course, 724-942-3002. I can't refer you enough to the archives to dial up part 1, which we did 2 weeks ago. Today is LDA part 2 with Dr. Kathleen Janel. I'm really proud to be able to bring her to you. We'll do that right after that first break. If in the course of our discussion with Dr. Janel you want to call in to ask a question or to make a comment, that number is and always will be 412-825-6262. That's 412-825-6262. I'll give that number additionally throughout the hour. Looking at our schedule, and boy, today we do turn the page, folks. It is the last day of the month of November in the year 2012. As we rejoin us, put ourselves together again on Monday morning, you're going to not want to miss that show either, especially, and by the way, this is such a unique show. If you're one of those patients who have walked the walk, talked the talk, and are quite proud of the efforts that you put in with your own health protocols and how you pursue health every day of your life, you want to have that edge. You want to know objectively whether you do have an edge. Well, guess what? You're not going to want to miss Monday's show. Dr. Ashok Shetty, a local physician, truly, and this word is brandished about all too frequently, anti-aging. Well, the anti-aging process is going to be delved into at quite length on Monday, especially for you who are out there at the top of the heap. Let's see how far you have ascended that heap. You'll want to pay attention on Monday. And on Wednesday, Dr. Vava Vavoom herself will be back. Of course, we're talking about Dr. Susan Smith-Jones, and she is always timely. I hear so many of you say how you enjoy hearing from her. She's going to be talking about how to get through the holidays without a weight gain. And that's right. That's going to be done in a 50-minute show. And she'll do it, too. So you want to pay attention to that one. And for those of you who are already planning to really rip it up in the month of December, which is so common with respect to your diet and going off the reservation, if you have an idea that you'd like to be involved with weight loss for the up-and-coming year, we're going to have Dr. Vera Sherman, who also is a local doctor working with a weight loss approach Her office is in the Monroeville area. That's the way the schedule looks up till now, and we hope that you take us up on our offer to come on in and share some time with us Mondays, Wednesdays, and Fridays from 8 to 9 o'clock. That's pretty much the schedule as it exists today. Should be mentioning that we're out there in the Monroeville area, meeting a lot of doctors, trying to bring them to you so that you know, Monroeville, you've been left bare. Not many of the clinicians, at least that I'm always aware of, moved to your area or practice in your area and brought to you these alternative treatments. I'm finding them, I'm exposing them, I'm bringing to your attention, and in so doing, we also have a presence in the Monroeville area. We are now out there 2 days a week, and you can schedule a time to see us, meaning myself, at our Monroeville office. Give us a call here at this office so we can schedule and slot you in. That number is 724-942-3002. Once again, 724-942-3002. We also offer ECP in our Monroeville office, which we have been doing so here in the South Hills for 10 years now, plus. And we've been out there only for a few months since the beginning of September, but it's going quite well. If you're interested in getting ECP done, that's external counterpulsation, don't know where to find it, then give us a call. We'll be happy to get you slotted in your own backyard. That has been the problem, but now we're there in your own backyard, and hopefully you'll avail yourself of that opportunity. 724-942-3002. Hoping to see you soon out there at the Monroeville office. Now, I don't want to delay any more today. This is an interesting topic, and I don't want to delay any seconds longer in bringing you our guest today. We're going to be talking about LDA with respect to the treatment of GI disorders. Now, this is a new subject for you. You want to pay close attention. This expert knows how to treat GI disease in a non-drug fashion. After all, she's a naturopath, but she's moved to LDA in some pretty serious cases. You want to hear her talk and discuss them. Dr. Kathleen Janel will be with us on our return. Be right back in a moment.
Do you have a mother, sister, or a daughter? I want to tell you about a new way to detect early signs of breast disease, thermography. It's non-invasive, there's no radiation, and it's painless. Thermal imaging offers a safe alternative for women and men in the earlier detection and monitoring of many diseases, namely breast disease. Other reasons to utilize thermography may be physical injuries and chiropractic issues. Your body may be sending you a message. Did you get the memo? HEAT. Health-enhancing thermography can read it. Early detection saves lives. Call us at 855-254-HEAT, 855-254-HEAT, or visit us at heat-images.com, heat-images.com.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9. We're here in a Friday morning version of the show, and in this past month, Friday mornings become extra special because each and every Friday, we've been bringing to you in the month of November some of the top-notch individuals, some of the best physicians in the world on a subject known as LDA. Now, that stands for low-dose antigen, and it seemingly might not make sense that immunological issues play a role in a whole bunch of disorders you never thought possible. One group of those disorders afflict a number of you, and those are the gastrointestinal ones. With our guest today, an expert in all things gastrointestinal, and our guest of 2 weeks ago, talking about LDA and GI disorders, we have today a real treat for you. You want to get the recorders rolling. You don't want to miss this one. Dr. Kathleen Janel, a naturopathic physician from the state of Washington, trained at the big boy, Bastille, went on to New England for about 6 years, returned and started her own practice in the Washington area, focusing and specializing in the treatment of GI disorders in a very special way. She graced our presence 2 weeks ago. She's welcomed once again. We welcome her back and say good morning. Dr. Janel, thanks for allowing us to invade your morning once again.
Good morning.
Hey, and you are bright-eyed, bushy-tailed, and I know it's 5 o'clock out there, and I'm going to apologize once again. I thank your husband. Did he help get you up this time, too?
Oh, he sure did.
Okay, well, I thank him.
Got the coffee going.
Got the coffee rolling. 2 weeks ago, when we brought you to the show, I really did focus on your naturopathic approaches to the treating of GI disorders. Like, that's the first question I'm going to ask you. For those who may not have listened, as a naturopathic physician, you have gravitated as a specialty, as a passion, as one that catches most of your interest. You've gravitated to the treatment of GI disorders. How so? Why so? And because the focus is so intense in GI disorders, you are the expert. How'd that come about?
Well, I think a couple of reasons, really. One of them was my own personal experience, where I was having the type of GI symptoms that I see a lot of my patients currently coming in with, and I really was struggling to get answers in the conventional medical world. And this was at the time where that was my primary focus, was to attend conventional medical school. And it really shifted things for me because it was, although my symptoms personally weren't life-threatening, they were really debilitating, and they were getting worse and worse, to the place where a lot of patients that come in to see me now, where they're literally, losing weight, they're dehydrated, they can't keep any food in them, and there's no really good answer for why. So that's what really sparked my interest, because I was reluctantly went to see a naturopath at that time, thinking, at this point I'll try anything. This
is after you tried a whole bunch of the allopathic world and didn't really get any satisfaction, if I remember hearing the story correctly.
Well, correct, because that was really my focus, and I really wasn't interested in natural medicine, in holistic medicine at that time. I think a little naively, but that's where I was at the time, and I really wasn't. I didn't really have the respect for that modality of treatment. And so I really sought out my treatment in conventional medicine. I've gone to gastroenterologists, I've gone to GPs, I made the rounds, basically, and wasn't getting any answers. And at this time, I was waiting to go into conventional medical school. I've been accepted into the program. I was, literally packing to go when all of these changes started happening, and I shifted gears. Because when I went to see a naturopath for the first time, after months of this, and I see people that have been dealing with it for years, but for me it was months, I had some immediate answers to my questions. I had some immediate relief, and I was impressed with the fact that we started dealing with my diet.
And lo and behold, changes have occurred, and you put the brakes on completely with moving into a medical degree. I'm talking about allopathic medical degree, and your focus and interest since that point has been all naturopathically. That brings you to what we'll call the expert level today in treating GI disorders from your own special approach. Now, last week, or two weeks ago, I really enjoyed, and I think my listeners did too, hearing you talk about, for the most part, how you do your naturopathic treatments. We talked very little about LDA then. I was intrigued about your approaches. I'm going to refer our listeners, rather than trying to rehash this and not doing it very good much justice, I'm going to refer my listeners to the archives. Head to the archives. You'll want to dial up the show of, my goodness, I can't recall the date, was the 16th, November 16th. Dial it up. That's a show we're calling that Part 1. And in that, you will hear all that Dr. Kathleen Janel has to advise you with respect to natural treatments for GI disorders. In a way, I guess what I'll ask you today is, you found, and I do remember you telling us, that your naturopathic treatments are successful for, by the way, look at these diseases here. IBS, anytime you have the word syndrome associated with a bunch of symptoms, you're in trouble right off the bat, because that means they don't even know what that is. When I'm talking about they, I'm talking about the conventional medical community. Ulcerative colitis, Crohn's disease, spastic colon, constipation, gut fermentation, bloating, the list goes on and on and on, and you have a pretty high success rate in treating all of these conditions naturopathically. Give us an idea about your breakpoint, the percentages of people that never need to move to the LDA component because you do so well with them naturopathically.
It's really high. Yeah, it's a really high percentage. I'd say, up in the 80s to 90% of people respond, and respond quickly. They respond very quickly. I'd say after the first appointment, and I get people started on supplements, I'm seeing substantial decline in symptoms and motivation, where people get some hope around the fact that there's something that can be done for them.
Yeah, probably in a very similar way that you experienced yourself, because it was that very same response, quick response, that enlightened you enough that made you move into this area completely, and you've now immersed yourself. So up to 90%, I think my listeners need to hear that, because they're out there flailing as you had with your allopathic armamentarium of these experts that had a whole bunch of things to throw at you but weren't giving you any quality of life. And so they need to know there's another way to pursue this other than the conventional allopathic way. And I do refer them to the show that we did on the 16th rather than rehashing it, to hear that 90% or up to 90% of the people don't even have to move into another treatment arena, but naturopathically their solutions are possible for them. Without getting this far, I think is soothing enough for the moment, and we're going to let it go with that for now. Then there's this group of people that try as you might naturopathically, and as successful as you are in some, wasn't really cutting it for a small percentage of your patients. Let's talk about some of those people and how it is that you were looking for another way, and how LDA apparently fills the gap. It allows you to treat now 100% of your people in a very effective way. What about that 10%? What about them? What made them so different? And why is it that LDA is so helpful to you in treating that group of people?
This group of people share one thing in common. There's many different names, again, and what we would say etiologies or reasons for their symptoms. But what they share is that group of people that have colitis. And so colitis is literally an inflammation within the GI tract that causes a lot of similar symptoms. Mostly these people are having uncontrollable diarrhea. They're having abdominal pain. And then within that, that shared area, there's a lot of individual symptoms that people will manifest depending on what the disease name is or how long it's been going on or where it comes from. But that's what they share for the most part. And these people, I was really looking for something for them because I really wanted to have an impact on them for a couple of reasons. One is that some of these people are not even responding to the drugs, so they literally don't have options, even to shut the system down, which is what the most successful drugs will do. Is just, you just turn the whole system off, and you have a whole other set of problems because of that, but at least you don't have those debilitating symptoms. that's one reason. And the second reason is that it's really important for me to keep people off these drugs that are being used to control the symptoms right now because of the amount of suppression they cause in the immune system and the consequences of that.
Talk a bit about those drugs, because if you're out there and you're saying to yourself, you know what, I went through that, but my doctor has me on this medicine or that medicine, and I have a life back. Of course, in some cases, that life is costly because it costs thousands of dollars a month for some of these medications. And you say, you got to think twice. Even if your symptoms are being curtailed, you're creating a host of problems that, on the other end, are going to cause you more problems than you have on the front end. Do that make sense?
It's true. With the ones that are being used now, the strongest ones, the tumor necrosis factor drugs, they're literally shutting down the immune system in a different way than steroids. Steroids also shut down the immune system or block it. But these tumor necrosis factor drugs, if you pull it up on, one of the websites or research it, and what you'll find is that there's a huge warning, and it's associated with various cancers. It's associated with a lot of really serious diseases. So the cost to limiting ratio when you're taking those things it's pretty high. It's pretty high, and I think that it's really good to have an option around that. And backing it up a little bit, historically, what these patients were started on was some pretty mild anti-inflammatory drugs, acecol, mesalamine. They take them orally or use them as enemas, and that, those are probably the mildest form with the least amount of side effects. But they weren't working that well for people. Personally, I'm happy if I can get people back down, dial their symptoms back down so that I can use a combination of LDA to desensitize them, manage their symptoms with these drugs that are going to be have less side effects while we're getting their symptoms under control. The next level of drug therapy would be the steroids, prednisone. Some people don't respond to those either. And then again, the third stage would be those tumor necrosis factor drugs that we were just talking about.
Representative, some of those, so that my listeners probably don't know they're taking the tumor necrosis factor substance. What are some of the names of those drugs?
The main two you're going to hear about are Humira, which is typically for Crohn's disease, and Remicade, which is used for Crohn's and ulcerative colitis. And again, these both have very strong cancer warnings with them. They're the ones that are injected, and they're the ones that have that big price tag that come along with them.
Very big price tag.
Mm-hmm.
And of course, those who do respond to them are thankful that they're available. But as you mentioned, the precaution here is, it may be helping you out of the jam today and really creating the jam of tomorrow, and that you're fearful you don't want to go back, and so you're caught in a holding pattern. Keeping your fingers crossed that the real bad stuff doesn't happen to you, and it's got to be a terrible position to be in. But these are the patients that you found for LDA would be the most beneficial. Take for me and answer the question that I think every listener may have right now, and it's a question that I think each one of the patients that you ultimately introduce this concept of LDA is going to ask, which is, hey, I've got GI problems. Why are you treating me like I have allergies, okay? What's the relationship between an allergy treatment and me? I could hang near a bathroom, 10 hours a day. Why do you think that I should respond to something that treats allergy? And in that answer, I think you'll be able to captivate the interest of our listeners today.
Well, it's really true, and it's because there's almost always a food component and or an infection component, and both of those things I can treat with LDA. So people with these symptoms, if you go back and you start to think really basically about our system, the reason the body wants to get rid of things so quickly is because it's being irritated. This is the wisdom of the body. It's pretty basic. It wants to keep you alive. It wants to keep you vital. And so if something's coming in that irritates it, it's going to want to get rid of it really quickly, regardless of the symptoms that you might be having. And so that's where you're seeing the abdominal pain and the cramping. So what LDA does is it actually desensitizes people. It allows people to tolerate the things they should be normally tolerating in the realm of food, in the realm of the bacteria that actually should be appropriately living in that system, so that they can actually withstand the normal world.
Now, how frequent is it that this concept of bringing in food, which nobody should be surprised, right? I mean, the GI system, from the moment you introduce something into your mouth until 50 feet later, it may pass out in some form in the next bowel movement. This food is in constant contact with the lining of the GI system, so it can't be a shock that something could go wrong when there's contact between substance and the mucosal lining. How many patients does that awareness is the first time that when you bring it up that, oh my God, you think it could be a food? Or how many come to you and say, oh my God, I know it's a food, I can't eat this and this and this and this? Is that pretty much the way it works out? They already know they have food issues?
It makes the most sense to almost everybody, especially when you're talking about gastrointestinal symptoms. Sometimes food is the underlying or one of the problems related to other symptoms, like say dermatitis, eczema, that kind of stuff. That's a little bit more difficult of a jump to make, that the food you're eating could be causing skin symptoms. But I think it's very obvious to people that their food can be one of the problems associated with their GI symptoms. It's pretty much a no-brainer, and most people have thought of that already. And I'll present a case during our conversation today where people try to figure it out, and they're getting frustrated because they're not getting really good answers from their body. It's a very complex system.
Yeah, too, and the fact that much of these foods lie in a category called delayed hypersensitivity reaction, where they may not even, intuitively they may know it's a food, but they don't know that they react to a specific food. Discuss for a moment, if you would, this thing about immediate and delayed, because LDA encompasses both of these, whereas the allergy world only really deals with immediate. I have it correct.
Mm-hmm. That's correct. In conventional medicine, we're very focused on immediate allergy because of the seriousness of the symptoms. So that's the type of immediate reaction where your throat swells up, you can't breathe, you need to use an EpiPen. That kind of thing typically happens with eggs and peanuts, and people know if they have that. That's a very obvious link in terms of exposure and then reaction. Whereas the delayed hypersensitivity is actually mediated by a different antibody, and that antibody we can find circulating in the blood, and it's a delayed hypersensitivity, meaning that when you get exposed to that food, you can have a reaction for up to 5 days afterwards. And that becomes really confusing because, and this is why I think it's frustrating for people to, start playing with their diet and doing elimination diets, et cetera, and ending up in more confusion than not, because you can eat a food on Monday, have a reaction still happening on Thursday, and you can be eating other foods during that time that you're also reacting to. So you can see how that compounds itself, and the reaction really never stops.
Great explanation. That's a wonderful explanation. I can wrap my head around that. I'm sure our listeners can too. Now, when we met in St. Petersburg, you were just nice enough to present some of your more complex cases to a group of doctors. I might like to ask you, if you could, think of a couple of the cases, some of your most memorable ones, and walk our listeners through how they presented to you, what they were doing at the time, what steps you initially took. Take us through, just like you did in St. Petersburg, because my mouth dropped open then. I think the listeners' mouths will drop open now to see how intricate a workup you do, a lot of testing involved. It's complete. And by you taking a representative case, I think much of the discussion will make itself self-evident.
Yeah, sure. And I want to just back up a sec before I say that, and say that I'm very fortunate to work in a state where I actually have the ability to prescribe, because that allows me to use the LDA more successfully. So it's interesting how I started out with a conventional medical focus, allopathic medicine, shifted complete 180 and went into naturopathic medicine, and now find myself incorporating both of those two things together, and I think to the benefit of patients. You're not over-treating them and not under-treating them, because the full prescriptive rights are available to us in certain states. So anyways,
that's a very good point to make. I think our listeners are all too aware. They understand there's something called a naturopath. They just don't have an awareness of how, in some states, the scope of the treatment and the ability for them to be, you're on par. Everybody's on par at the same level up there, whether you're allopathic, naturopathic, or osteopathic. All three specialties survive in treating patients, but they do so with the appropriate licensure. You're able to prescribe just as an MD or a DO does, correct?
That's correct.
Okay, so I'm glad you moved back to Washington. Okay, you left it for a while, you came back, and now there you are up there. The interesting name. What's the name of the town? It's a very interesting name to me.
It's called Mukilteo.
Mukilteo. Okay.
Yes.
Interesting. And is that like near something big?
Luckily it is. I actually live in Seattle. Mukilteo is a small, not so much small. There's really not even a separation between where Seattle ends and Mukilteo starts, which is a little bit north of Seattle.
Okay, so you are near a booming metropolis. In fact, you live in that booming metropolis. You have a couple of your miles around. Your reputation, I'm sure, precedes you. Talk to us about a couple of cases that you met. Started to treat them one way and realized you may have to go another way, and give our listeners a flavor for how the intricacy of what needs to be done to these patients ultimately determines how you win. By winning, we mean literally these patients are curable when in fact they never believed it was possible. Go ahead.
Yeah, true. I think the first one I'll talk to you about is a woman that really inspired me to look deeper, to find other answers for her, and that's because she had severe symptoms and was one of the people that was not responding to drug therapy. So she was very motivated, for one thing, and I really wanted to get some relief for this person. So when I first met her, she's about 48 years old, and she's one of the microscopic colitis patients. So she'd been through the biopsy, she'd been through the gastroenterologist, and wasn't having any relief from her symptoms. And when I first met her, her symptoms were literally 10 to 20 watery bowel movements a day. She could not leave the bathroom. She could not leave. She literally lived in the bathroom. She was having severe abdominal pain, severe. Again, the meds weren't touching. So she was unable to leave her home. It was impacting her life. It was impacting her husband's life, because he was so concerned about her that it was difficult for him to stay at work, not wanting to or needing to come back and check on her all the time. So she was vomiting a lot during that time, which was causing an erosion in her esophagus, so that was compounding it. She noticed that the vomiting was better without dairy, so that was, again, one of the places where people are trying to put this link between their foods and their symptoms. Mm-hmm. She was losing hair, and that's because she wasn't actually able to absorb her minerals and her vitamins that were necessary for hair development and the proteins because of all this vomiting and diarrhea. And my cat just decided to sleep on top of the book that I'm using, as they do. She also had a list of other symptoms, both related and unrelated to these. She was having allergies, extremely fatigued. She had Barrett's esophagitis, and this is what occurs precancerous, essentially, in the esophagus. She had fibromyalgia, depression, hypertension. She She had insomnia because of her symptoms. She was having menopausal symptoms at that time. So just really, really a whole package of things that were very uncomfortable for her. And I think a significant history, and this is where the whole probiotic conversation is going to come up for you and your listeners, is that this woman had been on about 20 years of antibiotics, or 20 years of daily antibiotics, and this was because she had a skin condition called hidradenitis. And so that was a treatment for it. And in my opinion, what happened for her, other things too, but, this is a really big piece of her history, is that literally these antibiotics constantly were killing off what was beneficial in her GI tract, and then resulting in these kinds of symptoms. Yeah. And what's interesting is that, to jump ahead, after we started using LDA, the skin cleared up. So literally, the skin symptom responded to the LDA as well as the digestive. So when I met her, she was taking the Acecol, which is one of the lower level drugs, that was having no effect on her system. So she had basically resigned to using over-the-counter Imodium, which gave her a little bit of relief. And when I first saw her, we did a full panel of testing. We did blood work. We did, basic blood work. We did blood work for food allergies. We did stool testing, looking for the microbiology, which is the bacteria in the stool. We look for the mycology, which is fungus in the stool, or yeast, and we look for parasitology. And the panel I use also gives me the probiotics, so I get to know the bad stuff and the good stuff that's in there. And we tested for celiac disease to rule that out. That's a genetic gluten problem that people have. We did a bacterial overgrowth of the small intestine. So we really did everything that at the time I was aware of that would be underlying the symptoms that she had.
How did she fare with all that? Pretty sophisticated testing you put through.
It's very helpful. When I feel like all these tests is very helpful diagnostically. Well, while we're waiting for those tests to come back, I put her on what would be a standard anti-inflammatory type of diet. Take out any well-known irritating foods. And the test results came back with a little bit of information. We found out that she actually had this delayed hypersensitivity reaction to dairy, to egg, to yeast, and to gluten. And we found that in her stool testing, she had elevated white blood cells, which is no big surprise to you or I. That means that her body is actually trying to fight some kind of infection in there or irritation. In this case, I think it's the food. And she came up high with a yeast species and low with her own good probiotic flora, which is, again, what you'd expect after antibiotics for that long. So this was, all very helpful information and significant information. This was one of the people where it wasn't, her symptoms were so severe that it wasn't that significant to remove those foods for her, and that's what she'd found on her own too. When she'd remove food, she'd take a food out, she'd get some relief, and then the symptoms would all come back a couple weeks later. She'd take another food out, she'd get a little bit more relief, the symptoms would return. So what that's telling us is that there's a sensitivity to many, many foods, and whatever her body's exposed to a lot of, she's going to develop that sensitivity to.
So by eliminating those, she probably got some almost immediate relief. Did she get relief with just elimination alone?
This is what's interesting, is that typically I'll find that when I identify these foods and remove them for people, they get an enormous amount of relief, sometimes full relief of their symptoms. That wasn't the case for this patient, and again, that's why I started looking outside of the medicine bag that I was carrying.
Which is that 90%er when they do respond to the elimination, it may allow you to never have to proceed to the LDA. But she didn't, huh? That was why you had to move further. Okay.
Yeah, and that that's the wonderful thing that pushes you further. That pushes you further to come up with other answers. And in my mind, there's always going to be an answer. So I'm not going to stop until I find it. And that's when the LDA started to come to the surface for me, and I started looking at it thinking, I wonder what this would do. So what happened was when we started doing the treatment based on the lab results that we got, so treating the yeast that was in her system and working with the foods, her symptoms dropped down to about half. So now instead of, being in the bathroom all night, she was able to sleep through the night, but she was still unable to leave the house. She was still having a lot of abdominal pain, and her husband was still having to come home to check on her throughout the day. She was also very weak because of all these chronic symptoms for so many years. So I put her on some B12 shots, and this lady is she's wonderful. She will just take on anything. And so she started giving herself her shots at home because she needed them so frequently. So we had her on a really high dose of B12 and folic acid to start to help increase those energy levels and help her nervous system and her adrenal glands, which were just really low functioning at that point. So this went on for a while, and we were doing more, this treatment, and she stayed about the same until her first LDA. And at that time, I'd been seeing her probably for a couple of months. So I gave her the lowest level of the forms of the LDA that we have for foods and for inhalants.
Yeah, the most dilute form of the allergens we're talking about, right?
Yeah.
Yeah, the most dilute, the 10 to the 15th or 10 to the 17th, really diluted, just shy of homeopathic.
Exactly. Yeah, very, very, very low dose, and that's the beauty of this. That's how it works with an activator. So that all the foods are in this formula with an activator to activate the T-cell response that we want. When I had her follow-up, which was 2 weeks after we did that first LDA, she told me that right after the treatment, she had 4 days where she was completely normal. She had formed stools.
That was miraculous for her.
Yeah. Yeah.
Oh, yeah.
She was very excited. She was very happy and very hopeful to have had those symptoms completely cleared up for a period of time, and obviously to do with the desensitization that we've used. And, for this case, this particular case, I've been following her for a couple of years now, and she continues to get better and better every time we do a treatment. So with the LDA, what happens is that it can take, 1 to 2 years for people to respond. We do the treatments every 8 weeks, no more frequently than that. It has to be 8 weeks or more where we do the treatments. And in her case, in this particular case, what happened is that she just continued to get more and more improvement. And not just with the GI stuff, as I mentioned before, her skin started to clear up. She started to get more energy. We started to work on some of the other symptoms that she was having that were a result of these things happening. Her reflux cleared up. Fibromyalgia.
Esophagitis.
Exactly.
Mm-hmm.
Yeah, exactly. All those things. I haven't sent her actually for a follow-up endoscopy, not yet, but I'd be very curious to see. And I love seeing this too because someone with Barrett's esophagitis, which is essentially, a precancerous condition, I've seen that resolve for people when we treat their symptoms like this. So it would be interesting to see in her case what the esophageal cells look like at this point, but I don't think we've done that. And that's mainly because, the symptoms all went away. So then, you're at a different place.
Mm-hmm.
See if there's anything else about this woman. Yeah, I had her on antifungals for quite a long time. But coming to the end of, where I am with her right now.
How many treatments in? So the first treatment responses, and then now time has moved on. You treat, by the way, the treatment consists of a little intradermal injection, right, this LDA shot that puts these allergens just under the skin. A visible wheal occurs, and then you do usually see some local response, like redness around the area, or maybe it stings for a bit or feels hot or warm. How many treatments in is she now, and where is she now?
She's about a year and a half into her treatments now.
Okay.
Maybe pushing 2 years. And it's like night and day, literally right night and day. We did some tweaking along the way. I found that because I wasn't getting the total response that I wanted from using just the food formulas, I started to introduce some of the bacterial formulas. So this is something that we talked a little bit about last time. some people are actually they're reacting not only to foods, but they're also reacting to the bacteria that are in the gastrointestinal tract that should be there, the good stuff.
Mm-hmm.
And so we can't get rid of that, and we don't want to get rid of that because that's protecting you. That's actually helping the digestive system function.
Flora. That's a good flora.
It's the good stuff.
Now, you know what
so,
is happening here? People are trying to get a shot at you. They are frothing to get a chance to ask questions of you. Do you mind taking some questions?
Sure. Yeah, we can.
I think it's a great part in it because your lady did so well. She's about a year and a half. What I want to find out. I mean, and so her life has been restored to her. This is a miraculous turnaround for this woman in a year and a half who didn't think her life was going to be amounting to much at all. So with that in mind, why don't we swing to our listeners and find out what they'd like to ask you. Come on. You're with Dr. Kathleen Janel. Go right ahead. What's on your mind? What do you want to ask her?
Hi.
Hi.
I have two questions. One is, since you're an ND and in the state of Washington, have you done any treatment for hearing loss with using homeopathic aldosterone?
Oh, that's a little off subject, but have you worked with that at all, naturopathic?
I have not.
Okay.
No, I haven't.
She has not. Any other question?
Second question was your experience using LDA with autism.
Oh.
Oh yeah, that's a really valuable tool for autistic kids and everyone in the autistic spectrum disorder, ADHD, and there's a lot of things that fall into those neurological disorders.
Absolutely.
And I've seen wonderful, wonderful results with this.
Because intuitively, I mean, even the DAN doctors would know that there's a food component. GFCF dieting is like a staple item. So from the very first day, foods are an issue with these kids. It's just, it can go far and above casein and gluten, right?
Absolutely. Yeah, it can be many other. I mean, those are very powerful foods in terms of these kids' symptoms. But there's also an underlying leakiness to the gut that will cause reactions to many, many other foods. And what I like about the LDA is that there's 300 foods in there that we're desensitizing against, in addition to some of the chemicals and preservatives that are added to foods that they also might be reacting to. So we can just cover it, in one shot and then repeat it every 2 months, which is a really reasonable treatment plan, I think, for these kids.
And I think it's almost universal, too. Tough to find a child on the autistic spectrum that doesn't have some bowel dysfunction. I mean, they're coming to you because they're bowel dysfunction, but because they have an autistic component, they're able to have their behavior issues dealt with, too, in a way that never seemed to be possible. So I'm sure in your practice, do you have many children that are autistic?
Yeah, I definitely have a percentage of these kids. I'd say maybe about 10%. And again, I'm not sure why this is lately, but some kids that are really, really medicated have been coming into my practice. I'm talking about 3 or 4 different antipsychotic type drugs. They're strong drugs, and it's really nice because what we can do is we can gently wean them off these drugs while we're doing the desensitization to solve the underlying problem or one of the main underlying problems. And I've seen them come back to life. Literally, I'm in the presence of these kids who are like waking up and being more available in the world and can connect with you and can connect with their families. And it's a really lovely thing to see.
Absolutely. Wonderful question. Great answer. Let's move to the next caller. Come on, you're in the store. You're with Dr. Kathleen Janel. Go right ahead. What's on your mind?
Good morning, Dr. Courtney, Dr. Janel. You just kind of touched upon my question. Since there's so many artificial colors and dyes and chemistry in foods, how do you test for those, or are you, and how are you treating those?
Go ahead, Dr. Janel.
There are some tests available for those, and they tend to be not something that I'll gravitate towards, just knowing that that's going to be a component. Those additives and preservatives.
They're in there. I mean, the nice thing is that although you do testing, one of the basic tenets of this is that you really didn't have to do testing at all because all of the allergens are in that stuff. Okay?
It's very true. It's very true. And so that makes it easy, right? We've got a food mix that has those things in it. If we need to, we can use a chemical mix if we suspect that someone has a lot more of the chemical reaction as part of their symptom picture. We can just, desensitize to this chemical mix that will handle the rest of it.
A treatment with great range. Wouldn't you say, Doctor? Just able to move into so many aspects, the chemicals, the molds, the inhalants, the foods, and all wrapped into one substance, one allergen. There's such a low rate of high rate of dilution, low amount contained in the substance, that it's difficult to do harm here. Wouldn't you say? It's another beautiful part about the LDA is the fact that it is so safe.
That's right. There's never been a clinical reaction, like you can have when you do standard allergy desensitization. It's a whole different mechanism. And I want to also say a little piece here about those drugs we talked about, the tumor necrosis factor drugs. They're affecting the immune system. They're affecting that T-cell operation, and that's what this is affecting too, but from a different way. From a different way that's not going to suppress the system, but help to shift the system so that it reacts the way we want it to react.
Perfect. Wonderful question. Any others?
Thank you.
Okay, very good. Great answers, Doctor, especially the thing with the autism. I didn't even think to pose that question about the autistic population, and with their GI problems, they are coming to see you, and nice to hear you having such great turnarounds, and they literally are waking up in front of you and their parents. Great story.
Mm-hmm.
But just checking, any other caller out there? Do we have another caller? Hello? No. By the way, with a few minutes left to go, if there is another caller, once you get in here, we'll try to let you on in. It's 412-825-6262. We've got about 5 minutes left to go. I'm going to let you sort of take to the helm here and direct us. What aspects of the treatment of LDA do you want to bring to the awareness for our listeners that maybe we hadn't touched upon, that is a perspective that through your experience now allows you to, if you haven't already shown a bright light of hope in the direction of these people, what other words of encouragement might you like to pass on to them? Yep. Goodness, I think we lost the doctor. I'm going to do this. There may be enough time, and I think I will. I'm going to take a quick break. Yes, take a quick break and come back. I'll try to hook up this telephone conversation with Dr. Janel so that we can let her finish herself off rather than some abrupt ending that occurred accidentally. Be right back in a moment with Dr. Janel.
Do you have a mother, sister, or a daughter? I want to tell you about a new way to detect early signs of breast disease, thermography. It's non-invasive, there's no radiation, and it's painless. Thermal imaging offers a safe alternative for women and men in the earlier detection and monitoring of many diseases, namely breast disease. Other reasons to utilize thermography may be physical injuries and chiropractic issues. Your body may be sending you a message. Did you get the memo? HEAT, health-enhancing thermography, can read it. Early detection saves lives. Call us at 855-254-HEAT, 855-254-HEAT, or visit us at heat-images.com, heat-images.com.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, everybody. Welcome back. Sorry for that brief interruption. Somebody hit a button. We don't know who, but we certainly wanted to reconnect with Dr. Kathleen Janel and allow her, in the waning moments here with just a minute or two to go. Dr. Janel, you with us again, my dear?
I am here.
Okay. Allowing you now to really bring this to a conclusion, I was asking a question literally to dead space. I didn't know you weren't there, but my question went something like, okay, with these ability for you to just come up with remarks of your own, what would you like to tell our listeners? You've inspired them. You have provided them with hope, but by the very cases you're discussing, what additional information do you want to leave them with to just give them even more ability to feel good about themselves and the fact no matter where they are, they can get this turned around. Their problem can be resolved.
I would like to say that there is a lot of hope for people, and I think it's important to empower patients to trust their own intuition in terms of what they think might be going on, to be their own advocates and seek different answers. And for some person, the answer might be, I want to take these drugs that work for me, even though they have a high risk. That's what works for me. That's the best choice for me, for my life. And for other people that have other outcomes that they want, other desires that they want, that they also have other options. And there's always going to be more and more options. And that's one of the exciting things about medicine, is that there's always going to be another answer for the problem. And the patients can choose what they want to do. And I'm very inspired because I think that I'm seeing the world of, Eastern medicine, Western medicine, naturopathy, allopathic medicine coming together more and more. And the underlying reason for that is that whether you're an allopathic doctor, a naturopathic doctor, or a different type of doctor, we all want the same thing, which is we want our patients to get better. That's why we started doing this in the first place. And so there's a lot of hope, there's a lot of options for people, and they don't necessarily have to stop at the first one and say, okay, well, I guess I have to do this. There's always different places to look, and there's lots of resources.
Yeah, for the first, to the first point, to know that there is something out there, that you don't have to live in your bathroom because you have no symptom relief. To hear there's another way is certainly a brightest light of all. As to whether or not you want to choose between conventional and unconventional therapy, that's a whole other matter. We got bongos in the background now, doctor, saying it's our time out of here. I want to absolutely thank you for sharing your expertise and your cases with us. Hopefully, I promise my listeners I'll bring you back. I'll interrupt your morning, but I'm going to give you a break before we do that again. Until then, this is Dr. Dennis Courtney with Dr. Kathleen Janel saying so long for AIM Impact on Your Health.